All right. Hi, everyone. I hope you are having a wonderful Tuesday. I can't believe it's almost the end of June, but we made it. We're here, and we have a wonderful treat for you all today. I'm super excited. We've been looking forward to this for weeks, and you see their lovely smiles right in the pane there. So today we are kicking off our series, Views from the C-Suite, how we lead home care post-COVID-19. If you'll remember, over the past couple months, CareAcademy has been providing guidance as we were living in real time in the COVID crisis. As we're emerging and states are literally reopening as we speak, we felt it was time to now turn our attention to the future. So what does home care look like in a post-COVID environment? Technically, we're not completely through the COVID environment, but as we're thinking about the future, there are a lot of challenges, but there are many, many opportunities and possibilities. And so we gathered the best minds in home care to share their thoughts with you, and also to get your feedback as well as your questions. So we're super excited. Our two leaders, our thought leaders, brilliant people that are sharing the stage with me today are Brian Petranick, President and CEO of Right at Home, and Jisella Dolan, Chief Global Advocacy Officer of Home Instead. And if we move right on into the next slide. So CareAcademy, just as a refresher, we're the #1 provider of online training. We're designed specifically for mobile. We provide portable records, so caregivers can transfer their records from one agent to the other. 160 hours of training specifically meant for home care. An online dashboard meant for your agencies and administrators to access training and see that in real time. Customer support both in English and in Spanish for caregivers as well as administrators, and API integrations meant for seamless access to training. So if you haven't used Zoom webinars, just a quick refresher, the control panel will be at the very bottom. The audio settings, chat settings, you can raise your hand there and ask questions in real time. We're going to get to as many of the questions as we possibly can, but as you're registering, you also ask questions, so we'll get to ask as many of those as possible. And if you're going to ask a question live, and we may have folks clarify their questions live, I think it always adds a really fun dynamic to hear other people's voices. We will take you off of mute. It'll look like these two images once you're taken live on the air to speak with Jisella and Brian. So you can submit your questions and responses below. All right, so without further ado, can we go on to the next slide? Thank you so much, Ashwin. So I would love to introduce Brian Petranick, a guy who needs no introduction. He's the president and CEO of Right at Home. Brian Petranick started his career in the healthcare industry in 1986, working in medical transportation. In these roles, he saw firsthand the challenges of receiving care outside the walls of hospitals and other healthcare institutions. With a deep understanding of the dynamics of care in the home environment, Brian left the medical transport sector in 1993, accepting a position with a national provider of home care. In 2000, Brian joined founder Alan Hager and launched the Right at Home franchise system. During his nearly 20 years with the company, Brian served as Vice President of Operations, Chief Operating Officer, and ultimately President and Chief Executive Officer. Brian's leadership has been instrumental in growing the organization from its initial location in Omaha, Nebraska, to an internationally recognized home care brand with over 650 operating territories in 8 countries. So very excited to have Brian. Thank you so much for joining us. And we'd love to hear comments from you about how Right at Home has thought about the COVID environment, the one that we're coming out of, and what's happening and how you're reimagining home care in a post-COVID environment. I'll turn it over to you, Brian.
Great, thank you. Thank you very much. Helen, thanks for the introduction. Jisella, I'm really looking forward to the conversation, and thanks to everybody that's attending today. I'm really looking forward to this. So, you know, it's interesting as I was kind of thinking about this intro here. I'm going to focus a little bit more just on kind of what we've been experiencing as an industry. It has been a journey for sure. I think everybody would agree with that. These last several months have really brought forth some significant challenges. But the one thing that I take away from this, and I've talked to our system about, and a lot within the corporate office here, is we are better for having lived this. We are better for having gone through this. And I say that realizing that there are people that have suffered. There's been, lots of deaths, way too many deaths due to this. But having said all of that aside, as an organization, our experiences, we've just learned so much through this process. And so, our focus has been fantastic over the last couple of months. The engagement that we've built across our system, which was always good, but I think now is at record levels. So there's just a lot of positive that's come from this. How quickly we were able to make changes, adjust to changes, those types of things. So, one of the challenges that we have now as an organization that we talk about a lot is how do we leverage what we've learned? How do we leverage what's happened over the last 3 to 4 months? And, we have a comment here, we say it all the time, my gosh, that was so February. So we'll be talking about something and we'll say, oh, that's so February. That's so February thinking, because that's how much things have changed. So, I've talked a lot over my career, especially within our system, about there's two certainties in the world, in this current world. The first is that things are moving faster than they ever have before. The second certainty is they're never going to move this slow again. And I think that has really come to fruition in these last few months. So there's been a lot of positive change within our system. There's been a lot of positive change within the industry that we'll probably touch on a little bit. I think we're seeing a stronger industry than we've ever had before. And so even, despite some challenges, some revenue challenges and drops that we probably all experienced, we're coming back strong and we're as bullish as ever about the future.
Fantastic, Brian. Thank you so much for your comments. I really appreciate that. And do you have any other, just as we think about context and context building of Right at Home, can you give us any insights into sort of where Right at Home is right now, or maybe Right at Home by the numbers?
Yeah, so we have presence in 47, as you see on the slide, 47 of the U.S. states, approaching, actually changed a little bit, approaching like 500 U.S. operating territories. We have operations in 8 countries, which pale compared to Homestead, which you're going to hear from next. But I think that context and having the exposure across 47 states, many of which were hot zones where there was significant just differences in how care is being provided and what those environments were experiencing, as well as with our global presence as well, really gave us a great perspective on just different ways to attack this pandemic, different ways to think. We've got some best practices from some of our European partners, and so again, things are going very, very well. We did experience a little bit of a dip, I think, which is pretty common in the industry. We're coming back very strong. We've had 7 or 8 weeks of straight, consistent growth, week over week. So really coming out of this stronger in some ways than went in.
Well, Brian, thank you so much. So I'll take my takeaway from some of your highlights are that this is a moment, and this has been a moment for Right at Home and certainly for home care to come out stronger and better than ever. And takes a lot of flexibility and flexibility of learning as well, it sounds like.
Absolutely. Couldn't agree more.
Perfect. Fantastic. And literally, as we were reaching out to the Home Instead team, I was told that the person that we're going to have on was an absolute rock star. Those were the words that came out of CareAcademy, as well as many other folks that were describing none other than Jisella Dolan, who is the Chief Global Advocacy Officer of Home Instead. Jisella Dolan serves as the Chief Global Advocacy Officer for Home Instead Senior Care. She's a member of Home Instead's executive team and leads its advocacy division, which is dedicated to advocating for aging adults and their families, ensuring a quality care experience, helping transform healthcare delivery, and shaping aging and home care policy around the world. She also helps lead Home Instead's diversity and inclusion work. She is Home Instead's representative to the Global Coalition on Aging and serves on the Home Care Association of America Strategy Committee. Jisella is a member of the Women's Leadership Council for Women Against Alzheimer's. She regularly represents Home Instead on the topic of family caregiving at global events, in the media, and at speaking engagements. So we're very fortunate to have gotten on our calendar today. We're very excited. So Jisella, we would love to hear more about, you also have sort of a global context of how COVID has shaped the home care and the healthcare landscape. Would love to hear your comments and your thoughts.
Well, thank you for that kind introduction. I wish my mom was on the phone. Paying this on the fridge, right? Just too kind. I'm grateful to be here, Helen. Thank you. Congratulations on your leadership, your recent capital infusion, and how hard you've worked to elevate home care and training in the profession. And Brian and I go way back. We're good friends, and we love connecting. So I was delighted to get to share a panel and have this wonderful conversation together. I echo a lot of what Brian has shared today. I thought I'd just quickly talk about Home Instead and then dig into some of the things we're seeing in the field as you talk about the future of home care and especially how it sits within healthcare. So like Right at Home, we started in Omaha. We just celebrated our 26th birthday. So we're in our mid-20s, we're thriving, it's going great. We have more than 1,200 locations around the globe. We are across all 50 states and most Canadian provinces. If anybody's interested in New Brunswick, we have that available, just say that. We are also in 14 markets internationally. So just like Right at Home, we really have that global experience, which has been invaluable because as we sat in the States, watching this wave of COVID move across the Pac Rim and into Europe and then to the Americas, we were able to learn a lot from our brothers and sisters in our other markets. So that's been incredibly helpful. We have more than 100,000 caregivers in the field at any moment. I think we'll probably talk a lot about workforce today. It's really critical because we have seen them as frontline first responders. We also serve in Wuhan, China. So that is where we believe the COVID started. And so right away, we were boots on the ground early on learning from this. So I'd like to just highlight a few trends and things that we're seeing. And I think we'll probably dig into some of these more deeply as we continue together. And I'd love to get Brian's feedback on these and yours as well, Helen. But one of the things we're seeing, and as Brian said very well, it's such opportunity. It's hard in these situations when people are experiencing tragedy, businesses are closing, governments are struggling, people are suffering. You've got to focus on that. But then like anything with the human resilience and spirit, we want to look at where's the positive. And that's really, I think, what Brian and I are wanting to share today is that we have such opportunity. Like you said, this is a moment in time for us as an industry coming out of this tragedy. So we want to frame this up as these are positives, but we acknowledge and understand how hard this has been for so many of us around the globe. But one of the things we're seeing is expansion of the healthcare ecosystem. And I think that's something that Brian and I and other leaders have been wanting for years, just that healthcare and government in their eyes, that they see home care and other non-traditional providers as valued as our healthcare providers. That we need to expand who has a seat at the table in healthcare to really evolve and revolutionize it in the way it needs to happen. And what's been really beautiful through COVID is that we have been defined as essential healthcare, which is something I think Brian and our teams have been wanting for years as we talk to policymakers and things. Everywhere there's regulations defining essential healthcare in facilities, and we're seeing this globally, they're including home care. They're also including technology providers, which we also think need to have a seat at the table. And I suspect we'll go deep on that today as well. So we believe that if we want to really transform how we deliver healthcare, how we help people age in place, we have got to bring everybody to the table and a variety of diverse stakeholders. And home care has its moment right now where we're being seen as part of the healthcare ecosystem in a way we haven't before, which is very exciting for, I think, all of us. The opportunity is endless. We also have seen a trend, and it's been happening for a while, that everything that can be provided in the home should be and will be, right? On demand, you think about Amazon, shopping, certainly.
Oh, I think we may have Jisella maybe frozen a little bit. Let's see if we can, let's see. Well, if anything, let's do this. So we're going to work to get Jisella back into the queue and see if we can reach out and make sure that she's able to connect. But I really loved where she left off. Let's see. Hey, Jisella, you there?
Hi, yes. Can you hear me?
Oh, yes. You left off at Amazon. You were on a roll, and we're getting really excited because you were talking about how things are moving.
I should have told you all, and I even told Helen and Brian, we're having internet issues, so I apologize. My dog has not walked through the room, and my 10-year-old daughter has not either. But those are coming next, I promise, guys. So apologies. So we were just talking about anything that can possibly be delivered in the home will be. And what's really cool is that for all of us delivering home care, we actually have a footprint in the home. So we're going to be able to empower and enable healthcare to move into the home in a better way. And they are going to need us to deliver the care in place. And we, I think, are going to see transformation of healthcare to move to the home, and we'll be in that leadership position. Another trend and thing that we want to focus on is the end of social isolation for older adults. It's something we're really passionate about. I think all of us in the industry, all of us that are in home care see the value and what we can do to empower seniors and help them physically, mentally, emotionally when we're building relationships, when we're connecting with them meaningfully. And as all of us have navigated the quarantine, and I'm a terrible quarantine person, I don't know about anybody else, but it's been just so tough not having connections with people I love and going to events and seeing things and travel. We're getting a taste of what so much of our older population around the globe experiences all the time. And we're in this unique position as home care providers to know what a difference even the small things can make to connect. And we would hope that through this experience around the globe as humans that we're all navigating with the quarantine, it'll help us be more empathetic to what's happening with seniors everywhere and to create an urgency for us to address that more rapidly. And I would propose that if we can address social isolation in a meaningful way, we will eradicate and address a lot of physical conditions and issues in things like dementia and so forth. Just a couple more quick takeaways, Helen, and then we can move on to the Q&A. We mentioned social isolation and technology. There's such a opportunity with the marriage of high tech and high touch, and it's kind of a buzzword right now. We talk a lot about if there's a way we could really find the magic between empowering the technology that brings us data and scalability and so forth with that human engagement piece that I think today we really need to make technology successful, especially with an older population. We can make that work. It really will be magical. And we've seen people take on technology through quarantine, COVID situation, especially with our older populations that maybe we haven't seen in the past out of need. Like Brian said, it's moving quickly. People are having to innovate. So I would suggest for all of us in home care, this is a real opportunity for us to continue to partner meaningfully with our technology brothers and sisters. And I know Right at Home and Home Instead and others, we have different pilots and tech innovations we're bringing to our clients right now, but I think we're going to see innovation move even more quickly. And if we can strike that right balance between tech and touch and how they come together, we're going to be able to navigate future pandemics even better than before. And frankly, we'll be able to scale our services at home care in a much more efficient way. And that takes me really to one of my last points is workforce. I think we all have heard over the years that healthcare said we need more folks to come be healthcare professionals as we have this age wave approaching us and increased chronic conditions, nurses, CNAs, et cetera. All of us in home care know that. We need caregivers too, right? They are the lifeblood of our industry. And so I think through the COVID situation, I don't know about you, Brian, we've seen a demand for our services, especially as people were leaving facilities and so forth. And our ability to serve as many people as possible through home care really rises and falls on workforce. Our ability to attract and professionalize and elevate this industry to bring more and more people to it, and also then bring in technology to help us scale further. So again, it's the high tech, high touch opportunity, but this workforce opportunity. And as Brian articulated with the positives out of this, we know, unfortunately, many people have lost jobs and the unemployment rates have risen across the globe because many hourly industries have had to shut down temporarily or sadly permanently. And what we would suggest is what an opportunity for us with groups like you, Helen, and CareAcademy, our training to bring workforce that we know is transitioning from retail and restaurant and hospitality and empower them and reskill and retrain to bring them to the home care industry and really create a more professionalized workforce that will help us navigate not only pandemics in the future, but just this increased age wave we're experiencing. So sorry about the Wi-Fi, but knock on wood, that was the one moment. Those are just some initial thoughts. I could go for days. I will not. I'll spare you all. But it's just an exciting time. I love where Brian went. It's this moment in time that we need to all capitalize on. We're the leaders, and we're helping to lead healthcare. We've never really had that opportunity like we have today. So we're just excited to partner with all of you and everybody on the call today, just to continue to serve as many people as possible.
Great insights from both of you. Jisella, I love, I would even say that, social isolation in and of itself is its own pandemic. But one of the things that I think you point out astutely is that we're all experiencing what a lot of seniors were experiencing pre-COVID, right? And so how do we look for ways, even in the midst of pandemic, to address the pandemic, but also issues that predate the pandemic, right? And those fall in line with also employability. Right now, we're in the midst of a crisis where upwards of 40 million adults within the U.S. have lost jobs. How do we reposition them potentially to consider and become a part of the home care and wider healthcare infrastructure? So that's really excellent. Do you want to point out anything else, Jisella, in terms of just context building as we're heading into this conversation? I think you mentioned them at the top of your notes, but I don't know if you want to.
Sure. Yeah, 1,200 locations. We're a franchise model like many of the larger providers like Right at Home and others, which really gives that independent leadership with the local market. We found franchising to be a great way to scale a high demand industry like ours. We are in 14 markets, continuing to expand, and I don't know if these are all the flags, but this is a good amount of them. And then I just think workforce, continuing to look at how we expand our workforce. And I think our services are all pretty similar to Right at Homes and what others provide, from that basic companionship all the way up to the 24/7 care. More than half of those we serve have Alzheimer's and other dementia. So I think as we talk about quarantine and social isolation, my stepfather sadly has dementia, and he's been in a facility during this time and hasn't been able to be with my mother since February, been isolated, and his frontal temporal lobe dementia, and he has drastically declined. He's losing long-term memory in ways that he hasn't before. And so I think as all of us are serving people, we know a good amount of our clients, our seniors we serve have Alzheimer's or other dementia. I think that's another facet to this whole COVID, social isolation, quarantine challenge that we need to figure out to navigate and also be a voice for those seniors.
That's fantastic, and thank you so much for your comments. So let's go ahead and let's start submitting questions. If you're on the line, and we have hundreds of people on the line, please start submitting your questions, and we're going to make an effort to get through as many of those questions as we possibly can. But let's jump right into it. Both of you alluded to the employability as well as incentivizing people to come into home care. So the first question that came through from Julie Black are, what incentives do we offer so caregivers will care for COVID patients or will care sort of in the midst of this crisis? And I think that's a bigger question as well. What trends have you been seeing in terms of caregivers coming in and, of course, staying in the field? If you both, can answer that. Brian, it'd be great if you want to start with that, and then just feel free to jump right in.
Yeah, without a doubt. I mean, we definitely need, as we go forward, we look at demand, we look at where things are going to be in 5 years and 10 years. It's very, very clear that we're going to have to bring new people, introduce people into home care. And I think that there's some great things that are going to come from this. As Jisella talked about, being signified as essential, those types of things. There's a much larger national discussion right now about home care and the role of home care. It's ironic you were talking about sort of the senior pandemic, the isolation pandemic. I actually just wrote an article almost saying those exact same things, is that what people are experiencing right now, or what we've experienced as a general society, is what seniors have been experiencing for years. in isolation, in their homes, not able to see their friends, not able to do the things that they want to do, etc. So I think there's now a national consciousness about what we do. Part of that, and if we leverage that appropriately, that can turn into, this is a great opportunity for us to bring new people in, see what kind of impact you can have on people's lives. Specifically regarding the question of additional compensation, we know, I'll stay away from what our government officials were contemplating with hero pay and some of those types of things that they were looking at from a legislative standpoint. As an organization, from a corporate standpoint, we did not take a position that you should incent people through pay. We chose to say, let's make sure that we have a workforce that is supported, that has the training that they need, they feel that they're going in prepared, they know what they're going into, they can feel safe, they know that their organization has their back, so to speak. And so we went to great lengths to make sure that all of those things were in place. Then we left the decision on if we were going to compensate up to the individual offices. And a lot of it's market specific. I mean, we found that some of our markets didn't feel the need to do that. We did find that some markets felt like it was important, or the owner felt that it was important to do that within that market. So we did leave that up to the individual at the local level to make that decision based on market demands.
Yeah.
Great. And Julie, you want to add something?
Yeah, absolutely. I like where Brian went. I think there's two buckets here. One is just in general attracting workforce. And I think there's a number of things we can do. Like Brian suggested, we have a spotlight on this industry now, and people see the value, the importance of keeping people safe at home. I think we want to continue to provide training opportunities, growth opportunities. Anytime we talk about our work, compensation, of course, comes into play. I think Brian and his team, like us, have done research on what caregivers want, and there is a compensation component, but it's also the connection with the seniors. They want training, they want to feel part of community, and so forth. So I think we all have as an opportunity as an industry to elevate and do more. In specific to COVID, we have had some of our home instead franchises agencies who did offer incentive pay for those shifts. But I like where Brian went, and I think this is something that, again, professionalizes the industry as a whole. Can we make sure that we are empowering our workforce so they feel safe? They have the proper PPE, the equipment and things going in. They're trained to know how to interact in a way where they are not going to be exposed and become ill, that they feel confident going in. And so, yes, the compensation incentive is one piece of it, but I think as a whole, we as an industry can give a lot of peace of mind and support to our caregivers so they feel confident approaching any situation. And while COVID has received a lot of attention, historically, our industry has served people with infectious illness and disease for years. You think about, we have clients that have MRSA and staph infection. We go into hospitals, HIV, and honestly, guys, the flu. And the flu, we can debate about the flu versus COVID, but we know flu takes, sadly, so many seniors' lives. It just doesn't have the same media attention that COVID has right now. And so we've had caregivers in the field with people with the flu, right? And so what I would suggest is that as an industry, we know we're becoming more and more of that essential healthcare workforce, that front line. We as a whole need to make our caregivers feel confident and safe so they don't feel like they need extra pay necessarily. They just know, this is my job, I'm professional, I can do this. So.
And one thing I'll add too,
go ahead.
Oh, I'm sorry. I was going to say, I think it's incumbent, all of us as leaders, there's been, Jisella mentioned earlier in the bio, or Helen, you did actually in Gisella's bio, that she's on the strategy committee of the HCOA. I'm on the board of the HCOA. We both are strong believers in that association and the need to have a strong association. And I was going to make sure that I said that today because I know I've got a lot of people on this call, and I think it's important for us to have a strong association. It's also important, whether it's through the association or through our brands or individual offices, there has been a narrative in the media for a long time about how poorly, in essence, that these workers are treated, right? That's kind of the general narrative. And I think all of us have to take the responsibility of starting to push back on that, to say, listen, in this we've learned how essential. We have great stories of caregiving. We just recognized our National Caregiver of the Year and our Regional Caregivers of the Year last week. And when you see these stories and the commitment and the selflessness of a lot of these caregivers, we have to start telling the story and do it in a way that really elevates, on behalf of the whole industry, elevates this profession and talks about it's not just the extrinsic rewards that people get, it's the intrinsic rewards, and that's important. So I think we have to do better as an industry, as an association, as leaders, to build our caregivers up and start changing that perceived narrative of, oh, these are just really underpaid, underutilized individuals. And part of that discussion has to be, listen, we also have to be conscious of the other side of this equation, which is we want to keep our services reasonably priced as we can for our customers as well, to make sure that we're an option for senior isolation and these types of things. So there's that balance, and I think we have to do, I know Homestead has led on this for a lot of years, being out there advocating, and I think we have to continue to do that as we go forward on this area in particular.
Yeah, if I could add to that, sorry, Helen, you won't have to ask questions, we'll answer everybody's questions. Brian and I could go for days, right? I agree, exactly where he went. And I think one of the questions that come in is, what do we need to be doing in this moment in time as we talk about this moment? I think because there is such a spotlight on our services being essential workforce, and it's really positive. We think about how facilities are being portrayed right now, and fairly or unfairly, right, and how home care is seen as, wow, this option. And then as Brian notes, there sometimes is a narrative about workforce. We as an industry need to hold each other accountable to deliver awesome quality care, to deliver on our promises to seniors and their families, and to be awesome employers of choice. We need to do both of those. And I would suggest, I know our Homestead franchise owners are amazing. I know Brian feels that way about his team. They're the best of the best. They love up their caregivers. They're awesome employers. They provide amazing care. We need to continue, all of us, to be leaders and elevate the industry, because we'd hate to have this amazing opportunity somehow get tarnished because of somebody not having a good quality experience, or workforce not feeling that they're being treated or kept safe in the middle of a pandemic. So I love that we have so many people on these calls, these webinar series, because it's going to take all of us, and there is room for everyone in this industry, right? I mean, Homestead and Right at Home can't serve all the need. We all need to come together and elevate the industry and be those employers of choice, so more and more people want to join us.
I love both of your comments, and it falls under the umbrella of, how does home care realize more than ever the opportunity by being an employer of choice? And I think about sort of the Maslow's hierarchy of needs, right? Making sure, of course, that we have things in place like PPE and all the protections that physically make sure that caregivers as employees are safe, but then it's also those undergirding things too, right? Brian, you mentioned HCOA, and Jisella, you mentioned them as well. We are really big believers in tying in with associations. This is a moment at CareAcademy, we're certainly seeing this as a moment to build a narrative around home care. And what you're talking about, creating ladders of educational opportunity. I think some of the questions that are coming in are, what are sort of the preferences around how do you create a ladder or a way to train in? And there are certainly competencies that are making themselves known in writ large right now, including, caring for someone with COVID. That's very specifically a type of training element, but home care has been responsible for caring with folks with infectious diseases for a while, and I think that needs to be acknowledged. I don't think that's widely known. I've been a caregiver myself, and in place of family members who've worked with clients who were quite ill. So that's a wonderful highlight of home care that deserves a lot of amplification and attention, and I think that was a really great response. Sort of moving on, how should home care aides be tested for COVID before returning to work? I mentioned at the very top of the call, states are reopening. We're literally in our office right now, and before I entered our office, I took a temperature check before I got on this webinar. How are you all reimagining the workspace, office space, as well as the home space as people are returning to work, and there's a lot more opportunities for spread of the COVID-19 virus? What are thoughts around that?
Do you want, Brian, do you want me to jump in? Sure. So I think, I think there's different layers. So Brian and I both help lead our global headquarters, which is a group of people that help support our franchise networks globally. And then each of our agencies are local and they have their teams as well as caregivers. I think one of the benefits, we know social distancing is a big thing you have to do in this, we believe in the spread of COVID is distance. And so one of the good things about our industry is that it's a destination industry. So we aren't like a coffee shop or restaurant where people are coming in, our caregivers are going out to the fields. The employees, there is real social isolation in terms of how they connect with each other. I think temperature checks, obviously, yes, there are protocols that different states require, and I suspect the CDC and others are going to come out with in regulating facilities and probably home care in the future in terms of protocols we have to follow. I don't think those have all been baked, but I think we can envision a time where we'll expect people to take temperature checks before each shift and document that so that the different home care agencies have a log of that information. In terms of the agencies ourselves, we've created a COVID resource center. I love your line, Brian, that was so February. That was so February for us too. We now have a COVID center. It's fantastic on our intranet, and it's got all sorts of resources. I think many providers are sharing with their home care agencies, franchises like we are, and we have lots of resources, and we have kind of an open backup kit and tools that we're sharing with our franchise network. It is very independent. There's state requirements, provincial requirements, but honoring social distancing is a big part of that. At our global headquarters, we're starting to open up this week with very limited group. We're taking temperature checks. That's a big symptom that we know can identify if someone has COVID. And then we're also, I think, really focused on choice right now. Everyone has a different point of view about COVID and what they're comfortable with. So we're really trying to honor what our team is most comfortable with. And we know we can operate virtually. And so if we need to do that into the near term until we have a better handle on COVID and how it's spread and so forth, we're honoring that. And our local franchise owners are doing that as well. So those are just a few things we're doing. A lot still to be determined, I think, as regulators look into this further.
Brian, do you have any thoughts?
I'll just talk, let me talk specifically. I couldn't agree more with everything that was said. I mean, very similar. Let me talk a little bit more about the caregiver environment. And, I think one of the things that is sort of the tendency that everybody's waiting for is when we actually get to the point where there's a vaccine. And we're still months and months and months most likely away from getting that vaccine. The testing environment is also evolving. So, I mean, I feel like every day as we get information in about testing, whether it's COVID testing itself or antibody testing or whatever, that the story seems to be changing. At first they were saying, oh, the antibody testing, once you have this, you can't get it again 2 weeks later. Well, we're not so sure about that, and you can actually get it again. And so I think with those types of things, I know at our office get a lot of questions testing and should we be doing testing, and there's a lot of concerns about the cost of those testings, that the testing kits that are available. COVID testing itself is a point in time, so if you test today, it doesn't mean you don't have it tomorrow. So I think that's evolving, and that's going to evolve for a while before we actually land on something that probably makes sense. And as the costs come down, I know some offices are testing. I know facilities are requiring, in some cases, testing twice a week for people that are coming in, caregivers coming in from the outside. So I think this will be an evolving and dynamic situation for sure, for a while.
Great. Thank you so much for your responses. Now, I am actually there. I think, Jisella, you may have touched a really great nerve and set off a lot of questions, actually, around social. I know, in a good way, Oh, good. A good nerve, because I think people are curious. We're getting a lot of asking for your thoughts around ending social isolation. What does that look like specifically in this moment, or are there any initiatives or technologies that you're excited about around the ability to end social isolation? And Brian, feel free to piggyback off of that.
Well, I think the beautiful thing about home care is there's a lot of tasks we take care of, medication reminders, transportation, bathing, and so forth. We could list them all. But the real magic of what we do is relationship before task and build connections. And we know those connections, whether virtual or in person, are what make people feel less isolated. And I think shining this light on social isolation is shining a light on home care and how just our services themselves address and positively impact social isolation and limit it. I think as much as possible, if we can be in the home during times like this, if we can help transition people from facilities, or we can go into facilities and help many facilities are short-staffed. Many of us go in and support and just build those connections with seniors, that goes a long way. There's also the practicality of we can't be everywhere. And so I do think, as I noted earlier, there has to be this interplay between technology and touch, high tech and high touch. Today, it's very difficult to, we all, I think, go to webinars and meetings and hear about all the exciting, innovative developments and new tech solutions. And I get jazzed about it, the Jetsons world where everything, comes down, your hair is done, all the things. But that's many years away. And we also know we have a population, and I don't want to be ageist, but many seniors are not as comfortable with technology. They didn't grow up with it. They don't know how to use it as well. And so we really need that human touch, that human engagement, almost like a coach, to help people use technology in the right way so it can unleash the power of addressing social isolation. And the beautiful thing is COVID, as I mentioned earlier, sort of forced that. We've had more of our senior population having to lean into technology because they have been alone and they have to be more involved with tablets and so forth. But I think for the near future, the near term, we have a great opportunity as a leader, home care, to connect people with the right technology to address isolation. And I think that's the future, when we aren't always able to physically be there. And then, as I noted before, just to increase capacity. There's a lot we can do from a social connection and care and monitoring and check-in standpoint virtually. We just need to get people comfortable with that, both our workforce as well as those receiving our services.
Brian, any thoughts on that?
Yeah, I'll just add a couple things here. I think, I view this question or this discussion sort of with almost two hats. So there's the business hat, there's the right at home hat, there's the private pay care side, however you want to refer to the industry, where, I agree with Jisella. We've got a lot of clients. We've been doing a great job over the years of decreasing social isolation for clients, right? Talking to families, that's part of the reason we're brought in as home care companies, that because we have a displaced society and kids don't live by their families anymore or their parents anymore. And so I think that there's things that we can do within the construct of our own business models to using technology, those types of things, to even increase and improve the experience that current clients and their families, future clients have. That's the business hat. Let me we also are part of this broader society, and there's a public health hat too, and that we think about when we talk about public health and those types of issues. This should not be a surprise. There was a survey done research years and years ago on Meals for Wheels, and it reported that the benefit of Meals for Wheels recipient on any given day was the 2 minutes of interaction that they had with the person delivering them. So this is not new. This has been around for a long, long time. So I'm hoping with the voices we now have, and empowered voice, and maybe the new lens that some of our policymakers are looking at, they realize that there's a whole lot of our population that doesn't have resources that can access the right homes and other organizations that are suffering from this issue as well, this isolation issue. So let's not continue down the road where we're doing more telehealth with home care and home health providers, and find ways to address social isolation for those that just don't have resources, because it's such a huge issue. The mental health, the physical health, directly tied to this issue of isolation, depression, and all of those things.
I would agree and build on that, Brian. I think that's really well said. There's that quote, it takes a village to raise a child, and I think it takes a village to care for our senior population. We owe that. And one of the ways that we can do that is bring in more community. It's going to take all of us to meet the needs of our elderly population, just like it's taken all of us to navigate this COVID experience, right? So we're thinking about ways that we can bring more community in. We launched a program called Ready to Care that's encouraging people in community to do care missions, to think about aging differently. Say hello to a senior, help your senior neighbor take their trash to the front walk on trash day. Just those little things. And as Brian noted with Meals on Wheels, that minute or two where you're talking to Mrs. Smith next door as you move her garbage can to the front stoop, that's connection. And this isn't just a feel good type of thing. We know social isolation impacts us physically and mentally, emotionally, increases chronic conditions. We know decline with dementia and Alzheimer's if you're not connecting socially. So it has significant repercussions on our healthcare system, our government system, and frankly, our spend. So if we can address social isolation, not only is it the right thing to do for our older population, now that we've all experienced it firsthand, we're like, oh my gosh, we must take care of our seniors better. There is all of this ripple of our impact on our social systems around the world. And it's just little community steps and efforts. If we take those, can make a world of difference.
Absolutely. And so one of the things that that sounds exciting is utilizing the resources that really exist in communities already in order to address social isolation. So Brian, I took to heart your Meals on Wheels statistic. It was breaking it just a little bit. So even just those initial first 2 minutes can make so much of a difference. If we have opportunities, or if there are opportunities for home care agencies to be the repository of what other tools exist in community, it's imagining the home care agency as a tool belt and a whole kit that surrounds the older adult. And I really love that sentiment of thinking just beyond our own four walls. What are the other places and other resources that we can pull in order to provide wraparounds of home care? So I love that sentiment, and thank you both for that too. I think we've all been talking about this, right? But in order for home care to really become a larger part of healthcare, there are things that we have to do as an industry, and then there's also the wider frameworks, right? And this is sometimes maybe not the not so fun part to think about, but Catherine Hughes, as well as a couple other people, have asked the question as we're thinking about, how we lobby or we legislate. The question is, what federal regulatory changes do you anticipate as a result of the COVID crisis? So we know that people are talking and thinking about home care. My co-founder, Dr. Madhuri Reddy, had a great piece published in The Conversation that spoke about sort of this deeper awareness. But what are the changes that actually need to also happen in conjunction with the awareness that's going on? Would love to hear from you. Let's start with Brian and then Jisella.
So I'll jump in. So I think as far as kind of the pandemic, there's some easy responses. I think we're going to see a lot more infection control, probably more guidance on how care should be done in the home, whether it's state or federal. OSHA has been pretty silent over the years on how care is delivered because they really have no control over private residences. But I think we'll see maybe OSHA taking a little bit of a stronger role. I think with some of the screenings, like the way we're providing screenings right now, it's allowed to do that under the ADA because they sort of suspended the ADA for a little bit. But I think that we may see some changes there as we go forward. I think we'll probably see some things on PPE. I think we'll see changing consumer behaviors as well because of all of this. I think, we're going to have conversations with our clients now, clients that we're admitting into our services or bringing into our services about the infection control and the measures that we're going. But I'm going to take this one step further. So you said, what should the discussions be? I have said for a long time in different forums, both internally and externally, that I truly believe that our industry is sitting on a gold mine of data. We are sitting on so much information because when we go into a home environment, we're there, at least across our system, we're there on about an average of 24 hours on a weekly basis across our network. And I've been in, as you said in my lead, I've been in the industry for 30 years or whatever. That number hasn't changed a whole lot. Even back in my days with my first home care company, the Kelly organization, back in the early 90s, it was 20 to 22 hours on average that we were in a client's home. So when you're in a house that often and you're there for 12 months out of a year or 8 months out of a year on average, you see a lot of the social determinants of health as being discussed on sort of the public policy side. You see all of the interactions with the family. You understand what happens in that house, the dynamics. You understand their medication regimen, what they're doing, what they're not doing, all of those types of things. So we're sitting on a tremendous amount of information that needs to be leveraged. First of all, we have a responsibility as an industry to gather that data and provide it to our policymakers and tell the story around it. But in addition to that, it's time for them to step up. And when I say the rest of the industry, I mean home health, I mean insurers, policymakers, to start to include us in the conversation even more so than they have recently, because we do have a lot of insight into what happens in that home environment. And when you send people home and then we're there for in between visits from home health companies for months and weeks at a time, there's a lot of information that we have that can direct public policy, that can change things, that can change the dynamics of aging in this country in a meaningful way, which is exactly what needs to happen as we move forward here. We're trying to bring down the cost of care. So understanding those social determinants as we understand them and the information that we have is a key to being able to do that.
Yeah, I would just echo what Brian shared. That's where my head went in terms of change. Anytime you're at a healthcare conversation anywhere in the globe, it instantly moves to data and integration. That for us to evolve healthcare in the way it needs to better serve, we've got to find better ways to integrate providers, payer sources, non-traditional providers like home care technology. To be clear, and we mean, in a way that's respectful of people's data, but that allows us to empower and be more predictive. There's such an opportunity for us to be more predictive in the field. And as Brian said, we're there every day connecting with families and with seniors in ways that nobody else is. How can we better knit it together and share it across all these stakeholders through community to provide a better experience, and then really start to predict episodes and escalation with chronic conditions and those kinds of things. And then certainly in pandemic situations, be able to share and help people. So I would agree that's one of the major areas. I also agree with Brian. I think we all need to be aware across all 50 states and across provinces, there's going to be all sorts of new regulations spun up about how I think facilities provide care, if we're going into facilities, how we provide care, and I would say home care. And we've been fairly unregulated, or we've been kind of folded under home health. I think we can anticipate some federal standards around training and so forth, which again, at Home Instead, we're not opposed to that. We just want them to be reasonable. So my bottom line, I think for everybody on this webinar is we all need to be advocates for our industry and those we serve, and politics are local. So get involved in your community, get to know your state and local officials, your provincial officials, federally, get to know them and tell your story. They're listening. COVID is top of mind for everybody, so you can share the work you're doing, but they need to be informed about the realities of home care, because often our well-meaning elected officials don't understand our industry. They think we're like home health or like healthcare, skilled nursing, et cetera, and we get lumped in. And so many of the regulations that get promulgated maybe don't fit exactly. And that can create real challenges, to Brian's point, around affordability and access for all. So we would just say, we all have a voice. Now's the time. We know these regulations are getting built. And so just share your story and educate our elected officials, because they're hungry for that information. And that will make sure that whatever regulatory schemes come out of the COVID situation really help us leverage and scale our services to more.
Great responses. And as we're closing in on time, I have a couple more questions that I think that folks are really eager to hear your responses on. So Brandon Mahan, I'm so sorry, Brandon, if I did terribly on your last name there, asked the question: we're starting to get more and more requests to take on COVID clients from our referral sources. What should we be aware of? What do we do for our caregivers who care for these clients? And how are other home care companies handling this? It just popped in my mind as you both were talking about some of the regulatory pieces that I think will also start to shift in light of home care being elevated. what are the ways that we take some of that information, that data, and talk across healthcare? How are you thinking about getting referral sources and talking across referral sources and into healthcare? What are some of the things that pop in your mind?
So first of all, can you hear me?
Mm-hmm.
Yes.
Because Jisella passed her technology issue to me and my phone just dropped, so I had to dial back in. So I missed the question. So Jisella, answer it.
Oh, no worries.
I can answer it. You
Yeah.
want me to answer it?
Yeah.
Brian says yes. The answer is yes. I actually brought my magic 8 ball. I brought my magic, and it says yes, most likely. That's the answer. Gosh, this is a really great question from Brandon, and I think it's got 2 pieces to it. First is, yes, we are getting asked to serve people with COVID. I think, again, analogizing it to serving people with the flu or MRSA or HIV, which I suspect many of us have navigated, we believe there's similar things you can do for your workforce. One, it's really important to us, is let them know. You should let your employees know if they're going into a situation with someone with infection, illness, or disease. That's just the right thing to do as a human, and that's a legally thing you need to do. So let them know and make sure they have the tools, the PPE, find great resources. I suspect we're going to see more and more access to PPE for home care. That's another regulatory change I think we need to make and evolve, is it's not just healthcare, which that's very important. They have PPE, but that we're part of that, right? So make sure they have the equipment, they know how to use it, give them training in advance, do quality assurance visits so you're there with them as they go out into the field. But we really want our caregivers to feel empowered to provide care. If you don't feel comfortable providing care, again, this is our, as an agency, you've got to make decisions on who you serve. As you went into Helen, kind of the second piece, you want to create a really strong referral network. And I think many of us have done that, but there's such an opportunity right now as the COVID intensity has declined a bit, for us to proactively go out to the home health providers and the facilities and the hospital systems we work with and say, let's have a game plan when it comes to probably, unfortunately, COVID part 2, right? How are we going to best refer and take care of these seniors coming from facilities to home to hospital, so that we can all share with consumers and our employees that we've got a plan, it's seamless transition, and the safety of our workforce and the safety of those we serve is top of mind. So.
Fantastic. And the question, Brian, was around referral sources, right? How do you prepare for the influx of referral sources that a lot of folks on the call are seeing, and some of the data that you all mentioned in the last question? How do you feed that back into sort of the referral sources and be useful to each other as we're all essentially now doing infection control?
Yeah, it's a fabulous question. I agree. I think that one aspect that I'll kind of add to what people said is, I think this is a great opportunity. This caught, for lack of a term, it's caught everybody off guard. I mean, this happened quickly. It accelerated quickly. It was very difficult to prepare for this, and as a result of that, I think there is an understanding that not at a given time, no one's really had this figured out, and it's it's kind of in a moving target. So I think when you're having conversations with referral sources or partners or companies that you're interested in working with, open, active communication. What are you trying to achieve? What are we trying to achieve? What are the challenges? How do we work through these challenges together? I think that is really one of the things that I've kind of noticed out of this is a much more openness towards, listen, this is tough for you, it's tough for us, no one's got this figured out, let's work together to figure out how we can handle this situation. And then also, let's give each other a little bit of a break, because we know in 2 weeks it's going to change again. And so we're going to have to evolve, going to change. And so I think communicate with your partners. I think we'll also see partners limiting down how much they've opened up that hotline, how many people that they're using, because they're trying to make sure that we have, the right types of things in place. It's easier to do that with 3 providers versus 25 or whatever. But communication with clients, communication with caregivers, communication with your partners is critical.
Absolutely. So what I heard from that in terms of both of your takeaways is a lot of documentation and having a game plan. It's preparedness, but also the flexibility in realizing that same game plan is going to change from week to week, from month to month, as we know more, as a vaccine becomes available. But that the exercise of the game plan and communication is going to be central and key. And I completely agree, Brian, with the sentiment that folks are going to be winnowing down, who that list of referral partners. So that documentation and that data collection in terms of your efficacy is going to matter as a provider. Y'all, this has been absolutely amazing. I want to leave on a hopeful note, right? So whether it's with home care or what's happening right now in the world, I'd love just a sentence from both of you about what are you most hopeful about right now? So I'll give you a second to think about it. What are you most hopeful about right now? Whether in your life, at your respective companies, or within home care, what are you most hopeful about right now? Jisella, you want to take that one?
Yeah, sure. I would just say, how lucky are we to be part of an industry that is such a solution to several major social global issues, how we care for our older population, which we know is a mega trend that our world has never seen before. We get to help solve that and support and uplift our seniors and families, and it's going to touch all of us. All of us are aging. Many, many, many of us are family caregivers. And then how lucky are we to be on the front line of a global pandemic that has brought us together as humans like we've never been brought together before, and that our services are on the front line empowering and supporting people and giving people jobs and hope. So to me, I just feel so lucky. I think we all should just feel so blessed to be part of this industry at such a critical time in our humanity. So I'm excited for the future and all of us working together to take this to the next level where we need to go in home care. So thank you.
And Brian?
Gosh, I don't know how I follow that. I wanted you to call on. I agree with everything Jisella said. I'll just add just a couple quick things here. I think, what I've witnessed this industry basically grow up over the last 30 years. And one of the things that I love, Helen, I love CareAcademy. I love ClearCare. I love Home Care Pulse. I love Genesis. I love the fact that I know when we sought out in 2000 to look for a software solution to support our growing, or what we anticipated was going to be our growing franchise system, there was really nothing out there. And we were using an off-the-shelf software program that you could buy at Office Depot. And now we have this industry that's grown, that's matured. We have partners, we have multiple options, we have ways to get insurance, we have different software solutions. And so we are still really in the infancy of our growth and our potential. This has also been an industry that has survived 9/11, the 2008 recession, now the 2020 pandemic, and I know it's not over, and hopefully there's not a significant second wave and all of those things. But I mean, we are resilient. We have made it through all of these things, and we are still providing incredibly meaningful services for our clients, their families, and providing great, meaningful work environment for all of our caregivers and our office staff. And so I'm just I feel incredibly fortunate to be in this industry, and especially looking at what lies ahead for everybody in this industry. The tailwinds are very, very strong, and I know there's probably a lot of people on this call that are tired and fatigued from the last 3 to 4 months. I think we're all feeling that to some degree, but we've got to turn that fatigue into energy to propel us forward, because we've got a great opportunity here. We've got the ear of policymakers. We've got a lot of people paying attention to this industry now. Let's take advantage of that and build on this beautiful future we have together.
Amen.
Amen to that. I love it. Thank you so much, Jisella, Brian. You guys have been an absolute blast. I didn't even need to be here. You guys could have completely run with it. Everyone who's been on the call, thank you so much for joining us for one of several conversations that we'll be having. And a huge thank you for Jisella and Brian for kicking off the series. You guys done a marvelous job. We're deeply appreciative at CareAcademy. Thank you so, so much. Have a wonderful week. Guys, we are at a great place to grow, and we'll talk to you all soon. Thank you so much, everyone. Bye-bye.
Brian, thanks, everyone.
Bye. Bye-bye, guys.